you're welcome to my channel Inside Life with Wasef Forbes. Today, you have with us a mental health nurse who will be talking to us about mental health. Specifically, will be talking to us about acute stress disorder and post-traumatic stress disorder. Please, let's watch and learn. So I have with me here a mental health nurse who's going to talk to us and introduce himself. So thank you very much for coming. You're welcome.
Thank you, Wasef, for giving me this opportunity to talk to the population about what mental health is all about, and more specifically on acute stress and post-traumatic stress disorder. My name is Acute. I'm a nurse with a bachelor's degree in nursing sciences, and my specialty at the master's level was in mental health medicine at the Acute University Institute of Goya.
Okay.
Thank you very much for having me here.
Okay, Mr. Raul. So was we hear about mental health and people use it every now and then. I use it. So what exactly is mental health?
Thank you very much for that question. Mental health is a state of physical, social and emotional well-being of somebody, and the way the person acts and feels, which affects his activities of daily living.
Okay.
Yes, when I talk of the way the person acts, that is the way you act in response to a particular stimulus, or the way you feel. For example, you might have people experiencing grief, which is normally culturally accepted that you just have to mourn for a period of a week or two, and somebody would extend more than that period, or somebody will not even complete the grief period. So that's why in a case like that, you talk of incomplete and complete grief.
Thank you very much for that definition. So after telling us about what mental health is all about, can you really give us a clue? So like as to the types, the symptoms?
Actually, so many types of mental illness.
Okay.
But I'm just going to name a few.
Okay.
Some of them you have schizophrenia, you have bipolar disorder,
Okay.
you have post-traumatic stress disorder,
Okay.
you have autism, you have
Really, autism?
Yes, you have speech disorder, you have children have eating disorder, all those things.
Even speech?
Yes, all those things as a result of a mental health problem.
Okay.
And some mental health problems are genetic.
Okay.
And some as a result of a pre-exposure to an event, which can be a traumatic event or an event that has a great effect on a person who is mourning a loss, for example, death.
Okay.
And also for the causes, there are so many causes as far as mental health is concerned. You can have substance abuse, it can be genetics, it can be as a result of experiencing a traumatic event, like I said before.
Yes.
And these mental health disorders, they have their various ways in which you respond to them. It's not in every case that somebody suffers from a mental health disorder that you are supposed to give treatment.
Okay.
And majority of the time, the nurses and doctors working in these hospitals do not have that specialized training to handle situations like that.
Okay.
So most of the time, they sedate the patients, or you have hospitals where patients are being chained in beds. So that is not culturally and according to the WHO, it is also not accepted to restrain a patient unless there is a need and necessity to do so.
Okay.
And it must require approval for you to restrain the patient.
Wow. I have a question, because when I advertised that I was going to sit down with a mental health expert, so I have some questions, and I can't take all of them. I'll just take, I think, two because of time constraint. The first question is, at what age can we experience mental health?
Actually, that's a very tough question to answer scientifically, but there's no particular age in which you can experience mental health. But
Okay.
mental health, there are mental illnesses in children, like you have autism,
Okay.
you have hyperactivity disorders. Those are illnesses which actually affect children, and there's not a particular age in which children can be diagnosed of mental health disorder, because mental health disorders have so many similar symptoms in common.
Okay.
You might misdiagnose a child of a mental health disorder, which might probably be as a result of retarded growth or poor cognitive development.
Okay.
So particularly to give an age range in which mental health affect a child, that is not certain.
Okay. Okay. And I have a second question from Anonymous. This person is asking, when she was pregnant, during her state of pregnancy, she went through a lot of stress. So she was sighing, she kept sighing, and she kept, putting her hands on her jaw, the African way of, you sad. So when she had a baby, the baby started sighing at a very early age, and the baby just did the same thing, like putting their hand on the jaw. So the person is trying to ask if, I don't know if that baby is born, is that mental health? It's trying to know if that is mental health already.
Well, we don't diagnose that baby of a mental health disorder, firstly. Secondly, at what age was this posture noticed on the baby? At what age? It's also very important, because it can be also due to our environment. If it's something the mother is doing constantly, the baby might be copying from the mother, thinking it's a good thing.
Okay.
So I won't diagnose that baby of a mental health disorder. Also, I will advise that they should do a follow-up, maybe with a psychiatric doctor.
Okay.
Yes. To actually see if it's as a result of the birth, you can see it as a result also a birth defect, or is there a child is just copying from the mother? Because in mental health, we don't just easily make diagnosis. You have to follow for a period of time to be sure of the diagnosis you're about to make. So I wouldn't say this child is suffering from a mental health disorder. But that notwithstanding, I'll advise her to do prior follow-up with the mental health specialist.
Okay, thank you very much for that. So I hope you've listened, Anonymous. I hope you got the responses to your answers, and I hope you're satisfied. Okay, so ladies and gentlemen, after understanding the notion of mental health, we the nurse, the health practitioner, specialized in mental health, has decided to talk to us about two of mental health diseases. That's diseases that are related to mental health, and these two are acute stress disorder and post-traumatic stress disorder. Did I call it well?
Yes, actually mental health disorder, not diseases.
Oh, mental health disorder, not diseases. Thank you very much for that correction. What is acute stress disorder?
Acute stress disorder is a mental health disorder which is as a result to exposure to a traumatic event, perhaps an accident, perhaps an assault, or maybe rape, within a period of 1 month.
1 month?
Yes, within a period of 1 month.
So what do you mean within a period? It occurs after 1 month that you had the event?
No, people who suffer from post-traumatic stress disorder,
acute
stress disorder, actually they do not have any they have physically unexplained medical complaints. For example, you can hear some of them complain of see things, they complain of hallucination and delusion, and they have increased awareness, thinking that people are chasing them here just because of the event which they experience. And that is just for a period of time. Within a month.
Yes. A month.
Yes, within a month, as far as the acute stress is concerned. And people with acute stress present with signs and symptoms of isolation, try to isolate themselves. There's also some of them go to the extent of sleep disorders as a result of the traumatic event. Some of them you have eating disorders.
So what do you mean sleep disorder, eating disorder? What does it mean?
Okay, when I talk of sleep disorders, like for example, you might go to work and every evening you come back, you take a shower, have some tea, and you go to bed. But as a result of acute stress due to exposure to a traumatic event, your sleep patterns are altered. You start having difficulties in sleeping at night.
Insomnia.
Yes, insomnia, that's right. That's the word. You're having difficulties in sleeping at night due to the traumatic event which you experience. And more so, it started as a result of you experiencing something. It's not like it was there before. Yes, so it started as a result of you experiencing something. It's not like it was there before. So that's some of the symptoms. And then you also have difficulty to find pleasure in social events. Yes, you are just moody. You also have mood swings, like at one point of time the person is happy, at one point the person is depressed. So you have things like that. And when it comes to the management of acute stress disorder, actually it is always advisable to use psychotherapy. When I talk
psychotherapy?
When I talk of psychotherapy, that means you don't initiate medications. You don't give medications in situations like that. You try to encourage the person to express their fears. And worries. You encourage them to talk more about it. And also you don't put too much pressure on the client who suffers from acute stress disorder. You don't force them to talk. You don't force them to do things. You let things flow in a way that is pleasant to them, and not you the nurse, the mental health nurse attending to the patient. You give them time to speak and express themselves. Also, there must be confidentiality. There must be confidentiality. That is very important. You need to have and make sure the patient is safe, the environment is safe and quiet.
Okay.
There must be confidentiality and avoid putting stickers or signs to prevent stigmatization.
Okay.
Yes.
Okay.
So it should be very neutral. The place should be a very neutral place.
I see, yes.
You don't make them look different from others.
Okay.
Yes. And psychological support, you try to give advice to the patient, to the person, involve community leaders to increase social acceptance in the community, people in the community to accept you for who you are without being judgmental.
Okay.
Yes, that's how you manage people like that.
Okay.
And for children, you might start having some children that have symptoms of bedwetting.
Hey, really?
Yes, some children have bedwetting. So when you have situations like that, you try to find out from the parents or from the guardians the history of the bedwetting.
Okay.
When did it start? Was it after the traumatic event?
Okay.
Or was it before? This will help you to make a good diagnosis.
Okay.
Because some children who experience traumatic events might start having bedwetting. And even in situations like that, you still do not give medication.
Okay.
Yes, you try to manage and encourage the parents, like you can help their children to empty their bladder before going to bed, or even wake them up at night.
Okay.
To use a bathroom.
Okay. Wow. So that is it about the acute stress disorder. That was really, really explicit. So you said, I really want to emphasize on the fact that you said when it's acute stress, it means the period is 1 month.
Yes, within a period of a month.
So what about if it exceeds 1 month?
If it exceeds a month, then you start checking, you start looking for other diagnosis of post-traumatic stress disorder.
Okay.
And you might also looking for other concurrent conditions, like maybe the person might be suffering from another mental health disorder which is not acute stress.
Okay.
Maybe there might be prolonged grief. Grief is a response to a loss.
Okay.
There might be prolonged grief,
Okay.
or there might be incomplete grief, which might also be as a result presenting itself in the form of an acute stress disorder. So you need to all of that. If you have all those things, you need to really understand. That's why in mental health, it's not like general medicine where you just go and give complaint of fever, joint pains, and there's a diagnosis of malaria and there's a possibility of it coming through. No. In mental health disorders, you have to follow the person or follow the patient for a period of time before making a diagnosis. Make sure you gather as much information as possible, because these mental health disorders have very common signs or symptoms. Their symptoms, signs and symptoms are almost the same. Yes, they have their unique differences.
Okay.
So you should be able to know that, and with so much information gathered, you are able to make the diagnosis.
Okay.
Yes, that's what it's all about.
Wow, that's a good one. Topic, acute stress disorder. I've learned so much from it, and and I hope you too have learned. So now we're going to be talking about post-traumatic stress disorder as another case of mental health. Another, how do I call it?
As another mental health disorder.
As another mental health disorder. I'm so sorry. So please, what is, I hear people talking about PTSD. That's how they call it generally, PTSD. So honestly, I don't know what it is. So what is post-traumatic stress disorder?
Thank you very much for that question. Post-traumatic stress disorder is a disorder as a result of an exposure to a traumatic event.
Okay.
Just like the same definition I gave you, acute stress disorder. And now this is as a result of an exposure to traumatic events which may last for more than a month.
Okay.
And in cases of post-traumatic stress, there are three things very common.
Okay.
The experience is mostly recurrent. Yes, recurrent. The experience is mostly recurrent. And also,
what do you mean by saying the experience is recurrent?
Like what we call flashback.
Okay, it comes to your mind always.
Yes, you see. And then there's increased threat, like you feel threatened.
Oh, I know that.
Yes,
like you are not safe.
Yeah, like you are not safe. There's increased threat.
Okay.
And then also, the third point is that avoidance. There's social isolation.
Okay.
You try to isolate yourself from people.
Okay.
You try to isolate yourself from people. You try to be on your own. And also, people who experience post-traumatic stress disorders, they have common symptoms like you have fear, you have mood swings, you have increased stress, like I said, you have social isolation, you have difficulty in sleeping, you have anger, you have anxiety,
What is anxiety? When you talk of anxiety?
When you talk of anxiety can be like being too anxious.
Okay.
Yes, anxiety. You are being too anxious.
Okay.
And also the way they respond to stimulus or events is different from the way a normal person who has not experienced a traumatic disorder is going to respond to it. And some of the causes, as I was talking about the symptoms, some of the causes might be as a result of drug abuse.
Okay. Really?
Drug abuse.
Okay.
Like when I talk of drug abuse as a post-traumatic stress disorder causes, when I talk of drug abuse, like somebody might have drug intoxication, and a person commit an act of rape or commit an act of like a murder in a very brutal manner. Now the person is acting under the influence of the drug. Yes, not actually the way the person. You might have also accident, or you might have things like war or natural disasters. Yes, all those things also. Yes, are causes of post-traumatic stress disorder.
So can post-traumatic stress disorder be cured? Can it be treated?
Yes, post-traumatic stress disorder can be treated. It can be well managed if you are being followed up by a mental health nurse, a psychiatric nurse, or a mental health doctor. It can be managed.
Up to the point of, you becoming mentally stable?
Yes, it can be managed, and you're fine, and you get involved in the community. So as far as the management is concerned, there are various ways to manage post-traumatic stress, but it is always good to start with psychotherapy. Because the reason why we always try to start with psychotherapy is because these mental health drugs have very wide side effects. Let me not say why. The side effects are actually not the best. So if you misdiagnose somebody for something and you give a medication, it might affect that person and cause more harm than good. So for post-traumatic stress disorder, it is always advisable to give psychotherapy. Just like in the same management of acute stress disorder, it's the same with post-traumatic stress disorder. You manage the patient, you give psychotherapy, you encourage them to express their feeling. And also it is important to know when the event occurred. The relationship of their client with the person who was involved in the event, maybe it was a rape or it was a murder case, to know their relationship. And also, and also you need to know, normally, culturally accepted, how long should, in case an event happen like this, how long should a person respond, how long should a person behave or be in response to the traumatic event? You also need to sort out all of that. Because for example, a patient might, a client, let me not say a patient, a client may respond to a situation, a post-traumatic situation in a different way as compared to somebody who might be under the influence of drug or maybe other mental health disorders. So in the management, you need to sort all of that. You need to sort all of that and be sure about it. Because if you have somebody suffering from a mental health disorder and you mistake the person for suffering from a post-traumatic stress disorder, their diagnosis and management will be poor and the results are not going to be effective. So in a case like that, you manage by providing psychotherapy. Yes, you encourage community acceptance. Accept the person for who he is. They encourage the person to express themselves. Make sure you keep the person in a safe and clean environment, free from stigmatization. Encourage good sleep pattern and a balanced diet.
Diet.
Yes, balanced diet. Good sleep pattern and a balanced diet.
Balanced diet has a role to play?
Yes, balanced diet here has a role because people experience post-traumatic stress disorder. They also have difficulties in eating. They have difficulties in eating. They have eating disorders. Yes, they don't eat like normal, like how it was before. That is why in the course of gathering the medical history, you need to ask all of this and you make sure you note them down. Yes, because they might be eating disorders. The person might see it somehow. Somebody might experience putacly, and to eat flesh is a problem to that person because of what the person saw.
That's right.
And so when you start preparing the person's food and you are putting meat, it's giving a different emotion.
That's right.
And also the person might experience a traumatic event and it comes home and you are killing chicken and the person experiences it.
That's right.
It's also giving a different emotion. So when I talk about balanced diet here, like give food, you give food to the person, not actually like you are starving the person, like you encourage them to eat regularly. Like Maria's, you encourage them to eat. Then also you might invite friends and relatives in the therapy. Yes, people he or she might like to talk to, or people he or she because people experience post-traumatic stress disorder like this always avoidance.
Yes,
avoidance, they want to be left alone. Yes. And being left alone is not a good idea. So among them must be that person which the person can accept, which he like. It's okay, like in a family, no matter how wild or how arrogant that is, there's always that one person in the family that can handle that. So that person might have that person, the victim might have that person in the family or a friend which you can confide in. And in people like that, doing the management, you don't force them to talk, you do things at their own pace. And so also in the management, you need to assess for sleep disorders. You need to assess for other mental health problems. It might be a contributing factor to why the person is behaving the way the person is behaving. So you need to know all of that.
Okay, then I have this question, this anonymous sent this question. We like what you're saying here, it's now I'm really seeing, you know, the values and I mean of such victims. Okay, so this person is asking what about a situation where, I don't want to say your parents are illiterate because some big parents are not even illiterate, but they don't pay attention to the mental state of their kids. With response to especially this acute stress disorder and post-traumatic stress disorder. You know, in generally, I don't really want to say because I haven't really gone into statistics, but generally, when you are from this kind of situation where you are traumatized and you begin to behave, like you said, hallucination. Yes, I've seen situations where people hallucinate and they begin to say they are pretending. That's how they tell me it. They say you walk. Sometimes they even take a cane and whip you head. Stop that rubbish. Are you the only one who experienced that? Were there the 5 of us, were there the 6 of us? What? Are you not even happy that you are alive? You know, the way they approach it is different. So what do you think happens to a patient like that?
Okay, in a situation like that, actually the person who suffers is the patient. Because the friends and the parents are not accepting the fact that you have a problem.
That is it.
And the management which they are giving you, it's wrong. The management is wrong. Normally, mental health is a specialization which is really neglected, especially
Thank you.
It's really neglected. You know, where you start presenting with change behavior, and people prefer to go to churches, people prefer to go to herbalists, some people prayer groups, and some prefer to restrain you and keep you at home. Like the situation you are giving me now, that's a very poor management, and it might lead to more chronic situations. It might cause more damage to the patient. So in situations like that, it is always advisable to seek help from a mental health doctor, from a mental health nurse, and all of that, or a counselor, to be able to find out what really the problem is.
So after having examined this, what can you tell us? Like, because you already said this, that it's neglected, and yes, I can agree that it's neglected. You cannot imagine that it's now that I'm getting to understand what mental health is all about. I mean, so what can you tell the viewers out there who've never known anything about mental health? What can you tell them? Especially you have mothers, you have siblings who are affected in one way or the other, in so many ways that especially exposed to trauma and the going out. You know, people every day, even on Facebook, you see people say, I want to commit suicide, and people insult them. Instead of, I mean, I don't know much about mental health, but I try my own small best that I know to try to talk them out of suicide, even though I don't even know if they read the messages. You know, so what can you tell us? What can you tell the viewers, us who are, have no knowledge about mental health?
Okay, thank you very much for that question. What I would like to say is that on our next video, I'm sure we'll be talking more about, you just mentioned suicide. I also like us to talk about suicide because the rate of suicide and poisoning there is too much. And probably drug abuse. I would like us to talk on drug abuse because drug abuse also is a problem in Cameroon. It's a really big problem. So to the viewers out there, I will just want to let them know that mental health is real. And mental health is real. So any psychological, any emotional, any problem which is affecting your activities of daily living, I'll advise you to seek help from a medical facility with specialized service of a mental health nurse or a mental health nurse practitioner or a psychiatric doctor, because mental health is real. People are dying and people are suffering. People don't want to accept the fact that actually there's a mental health condition. People misdiagnose mental health condition, and most of our doctors and nurses during their training, they have little training on the management of mental health disorders.
Okay.
They have little training on the management of mental health disorders. Because I've been in hospitals, I've been in organizations, majority of the mental health patients are being treated with sedative.
Okay.
Sedative, when I talk of sedative, like
sending them to sleep.
Sending them to sleep, like diazepam, and on sedative, like. And then in the villages, you really have some cruel treatment, like where they beat them,
Yes.
chain some of them. So mental health is real. This is not witchcraft. It is real. It is advisable if you notice any form of the above symptoms which were mentioned earlier. It's advisable to seek help in a medical facility with specialized training and mental health nurse or a psychiatric doctor. Also, you can go to a government hospital if you can't get access to a specialist hospital. You can go to a government hospital.
Okay.
You can discuss with a friend. You can discuss with them. You can discuss also with a counselor.
Okay.
An area mind. The most important thing is not keeping it to yourself.
Okay.
Because the more you keep to yourself, the more
you're more depressed.
The more depressed you are, and the more putting your problem become.
Yeah.
So it's always advisable to voice it out.
Okay.
But now the problem is that people don't believe and people don't listen.
Yeah.
So I just want all of you to know that mental health is real, and it's very important that you take your mental health seriously.
Okay, and the last question, but not the least, what do you think should be done and in order to do a sensitization on mental health? How do you think we can do it?
As far as the sensitization on mental health is concerned, I would first of all like to say it's a good idea. It's a good idea to do sensitization on mental health. But then before doing a sensitization on mental health, there are people that prefer to hide these people from the public due to stigmatization.
Yes.
So actually, even if you are to do the sensitization, that will still fall on deaf ears. That notwithstanding, it is important to do a sensitization of the importance of mental health. So I will encourage you, if you can look for a day and we talk more about that, and we plan on how to sensitize people on mental health disorders. Because more of our sensitization is not just about telling people mental health is real, mental health is real. There must be a message which we are going to pass out, which people might see and see a need to see a mental health nurse or a mental health specialist.
Exactly.
So it's not just about
telling them the literature. It's about practical something.
Yes. And we do that also with statistics based on the content of Cameroon.
Yes.
So this will be much more effective that way.
Yes, I think so too. Okay, thank you very much. I want to say thank you to our guest speaker, Mr. Are Neke Raul Etongwe. That was so educating. I've learned so much. I mean, I really missed not inviting you here before. It's like we should talk again and again and again and again. And I know you back there, you are having so much fun and so much intelligence. I can see the cameraman behind there. He's giving thumbs up. And I know we're going to have more and more thumbs up. So please take this lesson seriously. Mental health is real. Acute stress disorder, post-traumatic stress disorder are as a result of bad mental health. So we must work on them. Don't abuse those who have mental health. Love them, receive them, listen to them. Be confidential when they confide in you. Don't go spreading it out there. That will be destroying them. In short, I've learned so much and much. So I think we're going to have, with this knowledge, I've had enough. I think I'm going to have more and more and more. I'm designed for some. I think you're going to give us some of your time. Any other time again, please?
Yes, I'm sure our next video or our next program will be talking about drug abuse, not about substance abuse, and suicide. So stay tuned and make sure you hit the like button.
Okay, thank you very much. And once more, if you're just watching for your first time, don't forget to subscribe, and you got the education you needed. So, thank you for watching my channel Inside Life with WhatsApp Forbes. Stay tuned, and remember, the comment section is always open. Share your views about the different opinions on mental health. Thank you very much. Remember to click like and remember to leave us a heart. Stay tuned. Till then, we love you all. Bye.